talking to people about this. If a person talks about suicide, if they talk about killing themselves, feeling hopeless, no reason to live, some of these are more vague or secondary to the direct comment that I've been thinking about suicide, I've been thinking about dying. Certainly, as a provider or as a clinician, if a person says that to us, that's great because our starting point is right there for whatever intervention is necessary. But it's often veiled, and being a burden, feeling trapped, having unbearable pain, how does a person express that and how does it come out? But if they're talking about any of these things, it's certainly something we want to be aware of and we want to take care of. So that's the first thing is talk. The next one, behavior, is what they would be doing that would signal risk. Is there an increased use of alcohol or drugs? Is there a way that they look to end their lives? Are they withdrawing from activities? Isolating from family and friends? And again, for those of us that are in the fields that we're in, I think we should be pretty savvy to be on the uptake as to when people are behaving differently. And that's certainly something we want to look at. Other behaviors, and again, sleeping too much or too little, giving away things. I know that sounds like we hear that all the time. Well, they gave away some things. I didn't really notice that. But people do this. They start to put things in order and they start to give possessions, sometimes prized possessions, to their friends. And sometimes you go like, they might say, I have too much stuff, take my golf clubs. I have too much stuff, take this, take that. And you want to stop and think about how many things are being given away and why. Also, aggression, fatigue. So there's a lot of things that go into the baseline of why people start to contemplate suicide and dying by suicide. The mood area here, and again, we talk about depression and anxiety, number one and number two, for sure. The irritability, humiliation, and shame. We talked a little bit earlier about people that had legal issues, or maybe people that get incarcerated. There's a lot of stuff that goes on there, and coming out of that legal issue or that incarceration creates a problem for a person as well. So we want to be looking at why does their mood changed, what happened to them, and how do we get them on the track to feel better.